Okay, my name is Julee. So my topic today is animal testing. My major claim is that animal testing is not required by law as a form of research, and it is also not an accurate form of testing. So companies should look towards alternative researches. Animal testing is the conduct of scientists researching different chemicals on animals to obtain data on the cause and effects of various products. Animal testing is not required by law, but is performed to protect companies from consumer lawsuits, and is also to provide a safeguard on their products before hitting the market. As stated by the Food and Drug Administration, it only requires that each ingredient in a cosmetic product be adequately substantiated for safety prior to marketing, or the product must carry a safety label. The FDA does not have the authority to require any product tests. Animal testing is not an accurate form of research because the test results from an animal are different to human reactions. In fact, few breakthroughs have been made as a result of animal experimentation. There have been various catalogs of errors and failures in animal testing. As many as half the drugs that have been approved in the United States and the United Kingdom after animal testing have subsequently been withdrawn because of harmful side effects. One example would be that in May 1990, more than half the drugs approved by the Food and Drug Administration from 1976 to 1985 had such severe side effects that there was a recall on medications from all the markets. These were all previously tested on animals, and another form of animal testing that isn't accurate is acute toxicity, or is also known as the lethal dosage test. It is not an accurate form of testing as a result of only 65% accuracy. The acute toxicity test is forced into animals' throats or is pumped into their stomach by tubes, sometimes causing death by stomach rupture or from the sheer bulk of chemical dosage that the animals receive. It can also be injected under the skin into a vein or in the lining of the abdomen. The acute toxicity test does not accurately measure human health hazards and is very crude and imprecise. The test results can also be affected by the age or sex of the animal tested. The results can also be affected by their housing and nutritional conditions, also by the temperature, time of day and year, and the exact method in which they are administered the substance. Another form of animal testing that is inaccurate is the dry-up test, which is a substance capable of burning and eroding living tissue, injected into conscious rabbit, and is an extremely painful method of animal testing. Excuse me. Animal testing is not required by law, and it is a very inaccurate form of research. Also is that animal testing is very costly and extremely expensive because animals being tested must be fed, housed, and treated with certain drugs. Not only do these factors put into effect the increase in cost, but testing is done in an immense number of animals occurring more than once over a certain amount of months. There are actually alternative tests do exist. One is computer modeling and cell tissue culture techniques. Among non-animal methods, there's also an Ames test, which uses salmonella bacteria to determine toxicity instead of the lethal dosage or acute toxicity test. Companies can also use non-toxic or organic ingredients instead of animal testing, and others include computer and mathematical models, cell tissue cultures, corneas from eye banks. Animal testing is very costly, and the less expensive forms is also biotechnology, which has allowed scientists to study the breakdown of chemicals in human body through a test tube 3D imitation liver, which is a virtual reality system. And this accurately tests the results of communication simulators. My proposition is that because animal testing is not required by law and it's a very inaccurate form of testing, companies should look towards alternatives of experimentation such as cell tissue cultures and biotechnology.
All right, your proposition at the beginning is really the preview of the supporting structure. Otherwise, you have two claims, then a third claim, and your third claim is a policy claim. So it's very confusing. You need a single declarative sentence that all the supporting points are going to be advancing. Like I said, it sounds like what you're really doing is previewing the content of the speech. Those secondary points are not always phrased as declarative sentences, which creates a little bit of a problem as well. Background information's okay. We've got some factual data about FDA requirements, but I'm not exactly sure what that first point gets you. So the FDA doesn't require the testing. What does that mean? What inference should we be drawing from that? I don't know. It's just a random piece of information that doesn't seem to advance an inference. You have a lot of claims that are being presented on the second and the third points. I didn't hear many source citations. In fact, there was a statistic that said 1/2 of the medications that are approved between 74, I think it's 74 and 86, or 76 and 84, I forget what the number was exactly, ended up having to be recalled. And I'm going, okay, so where did that data come from? What's the source citation on this? And I have no way of assessing whether or not that information is accurate, whether it includes you know, what the base number is. It's just presented as if it's true without being given any reason to believe that it's true. And that happens in a lot of other places. You spend a lot of time describing some of the tests, which might be effective in a persuasive presentation, but it doesn't really advance the inference that you're making. You gave a whole list of alternative tests, but I got no data that showed that any of those tests are more effective than the tests that are being done currently. And it's a little counterintuitive. If all of these tests are more expensive than the alternatives, then why are they being done? It seems to me like it would be, there's a strong economic incentive to move to those other things, and as a consequence, it's not clear why this is a particular problem. And I think that there are a lot of things in the argument that are inconsistent as a consequence. I did see that you were trying to summarize at the end of the speech and that you had a restatement of your proposition. The problem, like I said before, is that the proposition's got 3 parts to it, and one part is a policy claim. There's occasional hesitancy when you're speaking, but you did a good job trying to develop the argument in a lot of different ways. You used your time pretty effectively, but like I said, some of the secondary claims are problematic, and the citation, the evidence, is also very problematic. And you were speaker 6, right? Okay, thank you.